are on Hartness Road, just down from Lowry Drug. We've been there at this location for about 35 years.
Wow. The same location?
Same location. I have just celebrated our 40th year of being in business.
Well, congratulations.
Thank you. Thank you.
You don't even look that old.
So we've been doing it a while. We have an associate with us now, Dr. Stephanie Werner. She grew up in Statesville. She was trained at Chapel Hill and then did a pediatric residency at the University of Kentucky. So we're very happy to have her. Ours is pediatric dentistry, which is a range of 1 to 18.
Okay.
Doc, let's talk a little bit about the business of dentistry. You know, so many people that they see these professions and they forget you got to make a living. I mean, you want to take care of your patients, but you got to make a living, and you've been doing this for a long time. What has changed on the business side of your industry, or has something changed over the years? Because it is such a unique industry that they see you as this true, genuine professional, but they don't see you as a business person. Can you talk a little bit about that?
And that's a problem, I think, in medicine in general, and dentistry in general. Your training does not encompass a whole lot of the business part of that. So it's kind of learned by the seat of your pants as you practice. As far as changes in dentistry are concerned, I think it probably relates to the involvement of insurance and the involvement of any third-party system. It could be Medicaid, it could be insurance. As everybody in medicine has seen, this adds a new dimension to how you manage the practice. You have to have the ability to understand the insurance industry. You have to have the ability to understand their payment systems. And you have to understand that there are a lot of people out there that need this coverage, do not have this coverage, and we're every day trying to find ways to connect people to programs that will allow their children to be seen in this environment.
You know, Wayne and I, we've got a small business advisory group that we put together, and we had a dentist that was part of the group, and we advised the dentist for years. And one of the things that surprised me, I don't know about you, Wayne, but it surprised me was productivity was such an important conversation with a dentist. And I never give that any thought, because when I go in to the dentist, I don't feel rushed. I don't feel that I'm being pushed out, although I'm ready to leave as soon as I get there. But the productivity of the service you provide is very important because that's part of, you've only got so much time in the day.
And you have to understand where how that fits. In pediatric dentistry, unlike general dentistry, our appointments are usually shorter in nature. Children, thank goodness, don't have as complicated issues as adults do. So managing that productivity, if you will, managing those appointments is a very important part of that. The other side of that with pediatric dentistry is that every child, it's not a generic issue. You know, you can be scheduled for an appointment with your dentist for a procedure that would be the same thing that Wayne would have. But Sally and John doing the same thing will be completely different because of their level of acceptance, their level of anxiety, their experience previously. So
because I'm going to be crying. There's no doubt about that.
Yeah, I heard you tell the story earlier this morning. What made you want to get into pediatric dentistry?
Well, out of college, I taught school for a few years and coached, and I think that was what sparked my interest in working with children. So that when I decided to go back to dental school, that was always kind of the forefront of my interest. And UNC had a really, really strong pediatric program, so it just fit well for me to evolve into that.
Great.
So let's dig in a little bit on this program that you're titling Celebrate Toddler Day. Let's talk a little bit about the program itself.
Toddler Day for our office was created to bring in young children, younger than perhaps the traditional age at which you would be taking a child for their first dental visit. The Academy of Pediatric Medicine and the Academy of Pediatric Dentistry now recommends an age 1 visit for young children. The reason they do is that there has been an uptick, an upsurge in early childhood cavities, a tremendous upsurge in this.
Because there's more candy that is chewable.
There's more candy.
It's delicious.
And as a matter of fact, this is from the American Academy of Pediatric Medicine. Early childhood cavities is the number 1 chronic disease affecting young children. Early childhood cavities is 5 times more common than asthma, 7 times more common than hay fever. And, of course, tooth pain keeps children from school and very distracted from learning. So the idea of creating a toddler day to get children into a pediatric dental office early is mainly an educational tool. It is to work with parents and let them know those stumbling blocks that are out there that could cause early childhood caries. And we see it every day that we work. And if we could have gotten to some of these parents earlier and talked to them about what causes these problems early, then they're preventable.
And let me just say this as a guy that has had horrible experiences young with a dentist. If the parents would bring the children in when there's not a problem,
exactly,
make them feel comfortable with you, and it's no big deal. Open your mouth, let me look in. Hey, things look great, and go. And so it doesn't seem like this bad guy the next time we actually have to go back and do something. It makes a big difference instead of wait till I got a toothache and now all of a sudden I'm going to get this mean, nasty man to give me a shot,
Well, I see at this event you're going to have balloons and T-shirts and all sorts of things.
We want it to be a little bit of a celebration of oral health. And there was a program created by the UNC Department of Pediatric Dentistry called Baby Oral Health, if you will, and we are a sponsor of that, and it's an educational tool. There are materials that we use to speak with parents and teach them on these visits what these problems are. One of the primary problems, and you see this every day, is that the children using sippy cups. Now, if a sippy cup, my children are too old to have used sippy cups. They're in their 30s. But if a child is only hydrating with a sippy cup full of water, there is never a problem. But the sippy cup invariably has a juice or a sweet tea or a sports drink or a soda associated with it. And so now we have a problem.
A sippy cup with a sports drink in it?
Yeah.
Wow.
Yeah. We have a problem that is a real severe problem because that is the key to starting early childhood cavities. Is bathing these teeth in a liquid that is full of sugar.
Interesting.
So the date is, I'm seeing 2 dates here. I'm seeing December the 7th and then January 25th.
Yeah. Right.
So what do people do if they want to be part of this?
They just need to call our office.
Okay. Give them the number.
704-872-6534.
704-872-6534. And so they would just set an appointment.
Right.
How long should they expect for this to take place?
We spend probably an average of 45 minutes with every parent when they're there. Again, we're not doing anything else. We're not scheduling any other treatment periods. This is all devoted just to those children and the parents who are coming on that day. And a lot of times, and I like this even better when both parents come. Because it's
this is really for the parents.
Without a doubt, as I said, it's really an educational tool. We do see children who will come in. We see young children who are referred to us by our pediatricians who are 14, 15, 18 months old that do already have caries, active cavities, and the pediatrician has seen them. So,
wow.
Yes, I know that's surprising, but we see it every week. The pediatricians see it every week. So this is why this program of getting kids in early, teaching parents what those pitfalls are is so very important for early childhood oral health.
Very interesting.
So any of you parents out there listening, 704-872-6534. Do you have a website as well they can go to?
Yeah, dentistryforyoungpeople.com.
Toddler Day, Dentistry for Young People, both December 7th and January 25th. Is that right?
That's right.
Hey, Doc, thanks for being with us today.
Thank you guys so much for having me. Hope you have a great day.